phone in here. Ask people for texted questions, and I don't bring my phone. Now, how bright is that? 507-838-5233 is the number. I'll get it during the break. 507-838-5233. Meanwhile, we want to talk with Dr. Clinton Muench of the Orthopedic and Fracture Clinic about their terrific honor, Faribault Chamber Business of the Year, Dr. Muench.
Business of the Year. We're pretty proud of that.
You should be.
Yeah, we feel like we earned it. We feel like we got it based on customer service, and our customers we call patients, and patient satisfaction is what we're striving to achieve, and we feel like we're doing a good job of that.
Well, I can't say that I've ever talked to a patient of the Orthopedic and Fracture Clinic who's ever had a bad experience.
Oh, that's good. Like any business, we have a few, of course,
sure.
But hopefully the overwhelming majority of our patients are happy.
In fact, one of your patients was telling me recently that what she really appreciates the most is that when you go for an appointment, if your appointment's at 3 o'clock, you'll see them at 3 o'clock. You don't have to wait around.
Yeah, we strive to try to make that happen. It doesn't always happen. You know, you book a certain time period for each patient, and oftentimes that runs over and that backs everybody else up. But you know, we pride ourselves on listening to the patient and you know, trying to answer all of their questions and take care of all of their needs, and not just go by how much time you've given them. So oftentimes we're running behind, and that's unfortunate, but you know, we try to do the best we can.
If I have a sore knee, I'm having a problem with the knee or whatever the joint is, do I need to have another doctor's referral to go into your facility?
No, most of the time you do not. You know, you can call us and we can help you figure that out, or you can call your insurance company and ask them, but most of the time you can just come see us directly.
Okay. In some instances, though, insurance may only cover it if it's referred. Is that what I'm hearing?
I think so. I think some, but I think that's more a rarity these days than the norm, you know. Most of the time you can just call us and we'll get you in. We've always got somebody available to see you.
So that nagging shoulder that bugs you and you can't sleep at night,
yeah, give us a call. You bet. Give us a call. We'll get you in.
And you guys will help them out.
We'll do our best.
That's great. Number one issue that you deal with, is it the knees?
You know, it's a little bit of everything. It's hips, knees, shoulders, hand, foot, and ankle. We do it all. See a lot of all of that.
Yeah, the Orthopedic and Fracture Clinic. We're going to talk a bit about sports injuries today too, which is perfect timing because last night we saw a nasty one in the fast pitch game. Shelby Meyer, junior pitcher for BA, throws the ball. It gets slapped up the middle. I mean, a screamer line drive, hits her in the knee. She's had dislocation problems with that knee. And that's just one example of a sports injury. Of course, us weekend warriors who maybe play a game of tennis a couple times a month or something, we're more susceptible to that, right?
Yeah, definitely. It's funny you mentioned the quote true athletes like your fast pitch softball player, but yeah, like you and I, the kind of weekend warriors, we're more likely to get injured. We spend less time doing the sport, probably less time stretching, and obviously less time practicing, and overuse injuries in our age group are real common.
No, I'm glad you brought up the stretching too, because I don't remember as a kid it being emphasized really at all.
Yeah, you know, I agree. When I was a kid, it wasn't much at all, and today I think kids take it more seriously, coaches take it more seriously, and I think a real important part of that is injury prevention kind of stuff. And I think you can lower your risk of an ACL injury by training kids how to land a jump or how to plant and pivot and cut. And there's different techniques that have been proven to show that you can decrease your risk of tearing your ACL in certain sports if you practice how to do those things correctly.
Yeah, I was just visiting with someone who had said their daughter played a lot of volleyball this past weekend and plays volleyball in the fall and basically plays volleyball all year round. That has to be one of the hardest sports there is on your joints with all the jumping and diving and hitting the floor and all that stuff.
Yeah, that sport is real known high risk for knee and shoulder injuries. You know, the shoulder injuries can be overuse, but then kind of can be an acute injury, and the knee injuries are real common. ACL tears in volleyball, basketball, soccer, especially on the girls' side of things, are real common.
All right. We're going to talk a little bit about that and what people can do to maybe prevent that when AM Minnesota continues. And again, I'll take your questions. You can text them to 507-838-5233, 507-838-5233 as we continue our conversation with Dr. Clinton Muench this morning. Thanks again for taking time to be with us.
Thanks for having me, Gordy. Appreciate it
very much. Are all the doctors there, do they all specialize in sports medicine?
Yeah, we all do sports injuries, you bet. Yep.
almost have to be an orthopedic surgeon, right?
Yeah, you do. It's real common. And you know, when we say sports injuries, it's a huge topic that covers everything. You don't have to be injured in a sport
Right.
to come see us.
Yeah, you could have a sports injury in a car accident.
Or just, you know, painting your garage or something, you can flare up your shoulder, and you know, that kind of falls under that umbrella of sports injury.
Well, we were just talking about this off the air, but we got a texted in question. If my knee's been injured many years ago and I hurt it again, if I come in to see you, what's the treatment I can expect? Will I get x-rays, some sort of an injection? What if I need a brace? Can I get it at your facility?
Yeah, we do all of those things. And you know, we first start with taking a careful history. Listen to the patient's story, listen to their past history. That's important. Have they injured their knee before? Have they had surgery? How did that turn out? What kind of treatment did they have? What kind of function did they have? And then what happened with their most current injury? And then we do a thorough physical examine the knee, check for swelling, check for surgical scars, check the range of motion, check the stability. And then oftentimes we'll get an x-ray to see if there's been a previous injury or previous surgery, or see if there's some early arthritis you can see on x-ray. And then formulate a treatment plan. Sometimes we'll want to get an advanced imaging study like an MRI, but obviously we know those are very expensive, and so we only order them if we feel like there's a need for it. And treatment plans oftentimes can include an injection, maybe a brace, maybe just some medication, maybe just some rest, maybe therapy, and then obviously sometimes surgery.
Well, you know, one of the best things ever is ice.
It works well. That's the eye and rice. You know, the common treatment after, you know, any kind of injury is to, you know, take it easy and put some ice and compression on it and see what happens over the next day or so. And you know, I think that's a point to discuss. You know, not every bump or bruise that happens during sports in the evening, you know, you don't need to drive to the cities and be seen right then and there. You know, it's not likely something that needs to be addressed right away. And you know, oftentimes the rice method will get you through the next day or so, and they'll quickly calm down, and you really don't need to see anybody. For the, you know, things that are severely painful, very swollen, and you know, those kind of things, then call us the next day and we'll get you in.
Yeah, I think I told you a couple of years ago I fell on the ice just outside the radio station here and sprained my MCL.
Yeah.
And boy, did that hurt.
Yes, incredibly painful.
It really hurt, and
yes.
It's swelling, of course. And boy, ice. I was never as much of a fan of ice as I was then.
Yeah, works very well. We use it all the time after injury and after surgery.
Makes perfect sense, though, when you think about it.
It does, yeah. Yeah, the thought is that it constricts the blood vessels and makes the swelling better.
And even now, you know, if my knees are feeling bad or something on the weekend, I'll put my leg up, put an ice on my knee, and watch, you know, Twins game or something.
Yeah, perfect. Tends to help.
It does. It feels much, much better.
Yeah.
Should ice be used for anything, though? Are there some things that you should not use ice for?
No, I can't think of anything. Ice is in general is real safe. The one you got to watch out for is heat. You know, if you put heat on an recently injured joint, or right after surgery, you're likely to make things worse. That's going to cause the blood vessels to dilate, and if, you know, there's broken blood vessels from an injury or after surgery, then those blood vessels will leak and you'll have more swelling, more pain. So you kind of want to avoid heat after an acute injury or after surgery.
So if I'm hearing you right, never put heat on an injury.
Yeah, I think that's in general good advice. You know, if you have kind of a chronic sore back or sore shoulder or something, and you're warming up, you're doing some stretching, then some warm heat, moist heat I should say, is helpful to get that joint loosened up. But in a recently injured or recently operated on area, ice is much better.
Well, that's good to know, because I used to, when I had some lower back pain, I'd sleep with a hot water bottle on the...
Yeah, I've done the same. I think it's helpful.
So that, in that case, it works fine.
Yeah, I mean, I think if it's not an acute injury, you didn't hurt your back, you know, lifting something, and now you're trying to get it to calm down, ice is probably better. But as that injury is kind of healing and you're doing some stretching, you're doing some rehab with our rehab guys next door, then heat to get it warmed up can be helpful.
Is a majority of your practice, you think, dealing with sports injuries?
Sports and arthritis are the two main components of our practice.
And you probably see arthritis in people of all ages.
We do, yeah, we sure do. Unfortunately, we're seeing it younger and younger. You know, people in their 40s are developing pretty severe arthritis these days.
You have a theory for this?
Well, you know, there's higher participation in sports. So like you said, if you've had an old sports injury, if you have an old neglected ACL injury, you're more likely to get arthritis in that knee. Obesity is the other big one, that I think contributes a lot. Is people are significantly overweight, and that can contribute to wear and tear in your hips and knees and cause early arthritis.
I have to tell you, and I think we visited about this before, but some people may not have heard it. When I did injure, when I sprained my MCL, they didn't do an MRI or X-ray or anything. They just immediately put me in therapy, which I thought was kind of interesting. You'd think you'd want to know what the problem was, whether you tore anything or anything. You can tell that by shifting the knee, or? You
can, and it depends on the time period. MRI wasn't widely available until the 1980s. So if it was prior to that, then nobody got an MRI, and you just assumed it was an MCL. And you can tell, oftentimes based on physical exam, what you're dealing with. So it really depends on the things we talked about: the history and the exam and the X-ray findings. Those three components are key, and then we can make an educated decision about whether you need an MRI scan or not.
Well, again, they didn't do an X-ray.
Uh-huh.
Just, felt the leg a bit and its stability and whatnot, and said they didn't think there was any damage.
Yeah, I like X-ray a lot. It gives you fantastic detail of the bone, and you can infer soft tissue injury from what you find on X-ray, and you can rule out fracture, obviously, with X-ray.
You're only supposed to have so many X-rays taken in a lifetime, right? Yeah,
the dose is pretty safe these days. It's really quite low, and you get exposed to ionizing radiation, almost every day in your life. If you fly, across the country, you're getting more X-ray energy. You're getting exposed to more X-ray energy than if you get an X-ray in our office.
Really?
Yeah, true.
Oh my.
But you don't think about it, right?
No. Well, and think of airline pilots.
Yeah, exactly. So, and as orthopedic surgeons, we're exposed to X-ray, almost daily. So are our X-ray techs, and obviously we take precautions to protect ourselves. But an X-ray here or there for our patients is very low risk.
Or stewardesses.
Yeah,
exactly. You want to leave them out.
Right, exactly. Flight attendants.
I don't need to get a nasty.
No nasty grams.
No nasty gram. Yeah, I like that. No nasty gram. But the braces are available at your facility.
Absolutely. Yep. We have a full line of braces that are tried and true, ones we've tried out and have had good luck with, and we have experienced people that fit you with a brace if you need one.
And that's probably the best route to go, rather than going and grabbing one off the shelf at some drugstore.
Yeah, I think so. I mean, number one, your insurance company is likely to cover it if you get it from us. We can bill them directly. And the other is the quality. We stock only quality braces, and obviously over the years with our experience, we've tried every different kind imaginable, and we've settled on ones that we've had good luck with.
Yeah, you can get some cheap old braces out there.
Yeah, that can be a problem, or poorly fitting.
Yeah. How about sleeves?
I like them. I use them a lot, especially with the knee. Anytime you have a knee injury or a knee problem, oftentimes some compression on the joint just makes it feel better. So I use them all the time.
You mean when you're playing tennis or something, yourself personally, or you mean in your practice?
Both actually. Yeah, I had an elbow injury working out, and I used a compressive sleeve on it, and it helped a lot, I thought.
I got tennis elbow once.
Uh-huh.
That's painful.
Yes, it is very painful. I've had a little bit of that as well. It's very common as well.
And there's really nothing they can do for it. At least
no,
that's what
not
they
true.
told me.
No. Who are you seeing? You must not be seeing us.
Oh my! I can do something for tennis elbow.
Absolutely. Again, the Rice method is a good place to start.
Well, yeah,
The quote brace for tennis elbow is a compressive strap to try to distribute the force over a broader area. Therapy is very helpful. There's some injections that can be done, and then there's some other more invasive things that we do, like surgery, to make refractory tennis elbow better.
Well, I was kind of trying to avoid surgery.
Oh yeah, so are we. That's our main goal, is to get you better without operating on you if we don't have to.
Because I had a doctor tell me one time, this is many years ago, said if you don't have to be opened up, don't be opened up. The human body is not meant to be opened up.
Yeah, I agree. I mean, oftentimes if we can just get it, kind of push it and nudge it in the right direction, we can get injuries to heal themselves. But, unfortunately that's not always the case. Or, oftentimes we're doing things that are counterproductive, and it's just not going to get better without surgery.
We have another text here asking if you have surgery, if it can be done here locally, and is therapy close by as well?
Yeah, really good questions. We do the full gambit of surgery here locally. We from all the sports injuries we've talked about. If you end up needing surgery, we can handle them right here close to home. And then right next door to us, we have a rehab facility that has a wealth of experience taking care of patients post-op in their recovery.
Are the surgeries done in your building or over at the hospital?
They're done at the hospital, yeah, not in our building. We don't operate in our building.
And they've upgraded those operating rooms, right?
They have not yet, but I've
They're in
been
the
told that
process.
that's in the process over the next couple of years. Right now they're working on their emergency department.
You'll probably love that.
It'd be nice, yeah, it'd be great.
They're going to be bigger? As I
I'm not sure.
understand it?
I'm not sure. I haven't seen the plans, but I've just been told over the next couple of years they're going to invest more money in the building itself.
And that's probably been needed.
Yeah, I think it's long overdue.
I know the emergency department, they're making some major improvements too, adding more rooms.
They are, yeah, that's what I hear.
So that's good to know. Over at District 1 Hospital, right across the street from you guys, right?
Yes, sir.
How much more convenient can you get than that?
It's like a one-stop shop.
Yeah, no question about it. And again, therapy available right there on site.
Yeah, right in our building, right next door.
So that's good. Again, if you have a question, 507-838-5233 is the phone number to text that question to. 507-838-5233. Certainly appreciate those questions this morning on our AM Minnesota show. Before I continue our conversation with Dr. Clint Muench, do want to plug tomorrow's show. Faribault Police Chief Andy Bowman will be in studio. This is National Police Week, so I thought it would be a good idea to have the police chief in, talk a bit about the challenges in his, I hate to use the word business, not really a business, in his profession these days, challenges in his profession. I always thought it was interesting that doctors have practice.
Yes, we're trying to get it right. We keep practicing.
Practice.
We see a lot in the police force. We see a lot of those men and women.
Oh, I'll bet you do.
Yeah, injured on the job or just overuse injuries. They all work out to stay in shape and, you know, beat the bad guy, and sometimes that comes with injury.
Yeah. Well, high-speed chase.
Yeah.
Chase on foot.
Yep, exactly.
All
Twisted
kinds
their
of
knee.
stuff.
Yep.
I'd
Yep.
wanna
We
be
see
in
them all
shape,
the time.
too.
Yeah.
Yeah. So again, Dr. Clint Muench is with the Orthopedic and Fracture Clinic here in Faribault. They were the recipients of the Business of the Year through the Faribault Area Chamber of Commerce this past year. And I know you guys were as proud as peacocks over there.
We are, yeah. We are very proud of that. They had a nice luncheon last week and presented us the award, and there were a lot of people there. It was a lot of fun.
Yeah, fantastic. And how many years you been here?
Our business in town since 1985.
Okay.
Bill Laney came to town in 1985.
Well, he got to town before I did.
There you go.
Dr. Laney. Yeah, I saw him from my shoulder when I
Yeah.
botched that up over in a car accident back in 1989. I remember going up seeing him over at the old Johnston Hall
Yep.
building.
Yep. We were up there for years.
How long have you been in your new facility?
Oh boy, put me on the spot. 6 or 7 years, maybe 8 years.
Okay.
Not long enough for me to unpack my office yet. It's still full of boxes after we moved.
Seriously?
Yeah, I'm just taking my time. I don't want to rush into it.
Again, the number to call, the number to text your question to is 507-838. You're just kidding, aren't you?
Oh, not actually.
507-838-5233, 507-838-5233. We were discussing this before. When I was a kid, I shot up. I grew too fast at one period. I know it's hard to believe when you look at me now, but I did. I went from like 5'3" to where I'm at now in a heartbeat. And so I had some knee issues.
Real common.
And I used to wear braces when I played hoops.
Yep.
But I was told not too long ago that there's a different philosophy in that now. That
Yeah.
if it were today, they probably would not tell me to wear braces while I play. Just strengthen your knee.
Yeah. I mean, you probably had Osgood-Schlatter disease.
That's what it is.
Yeah.
I can't remember how to say it, but that's
Yeah.
what it was.
Yeah. Seems like a German name.
It is
Yeah.
a German name.
Real common with kids as they're in those growth spurts where the bone is growing faster than the tendons and muscles are stretching out. So stretching for that usually makes that better. And you know, oftentimes, like we talked about, for any kind of knee problem, some compressive sleeve can help make it feel better. But yeah, for that particular issue, stretching and strengthening are the mainstays of treatment.
I will say I did suffer a lot of pain.
Yeah. Oh yeah, that's very painful. Probably have a big lump in the front of your knee too.
Right.
Yeah.
You hit the nail right on the
There you
head,
go.
Doc.
And
Boy,
it makes it
he's
difficult
good.
to kneel.
He's very good.
Yeah, real common.
So is the problem here bone on bone?
No, it's the tendon that comes from your kneecap down to your shin bone that helps straighten your knee. That has a growth center when you're a kid, and when the bone is growing fast, the tendon and the muscle are tighter than they should be. There's extra force that goes on that growth center, and so it becomes swollen and painful and inflamed. And so if you stretch out the muscle, stretch out the tendon, then there's less force on that growth center and the pain gets better. But the deformity you know, the quote deformity,
Yep.
is you're left with a big bump. You know, that tendon was pulling on that growth center, and it's permanent.
Yeah.
Yeah.
Well, I still have bumps on the knee.
Yep, real common.
And that's what it's from.
Yep.
I'll be darned.
Osgood Schlatter. Don't ask me to spell it. Osgood Schlatter.
Osgood Schlatter. That's exactly what it is.
Yeah.
Yeah. And they, of course, they didn't recommend ice back then. I would think that would have helped.
Probably would have helped some. Yeah, yeah. For me, I think rolling your quads muscles and stretching is the key.
Ah. So how much stretching do you recommend? Let's say I'm playing a weekend game of tennis with a good friend of mine.
Well, I mean,
I'm 57 years old. I don't know if that matters.
Oh, probably an hour then. No, I'm just kidding. But any is better than none. You know, in the old days, I mean, everybody still probably does it. You spend like 5 seconds stretching, and you know, stretching now before activity is not really recommended. It's more of a dynamic workup where you're doing some lunges or you're doing some high knees or some high kicks, you know, and then some sports specific stuff to warm up for your sporting event rather than just static stretching. It's after the participation, after the workout, is when you should do some more static stretching to lengthen those muscle tendon units.
Okay, it says here that they heard your group's no longer seeing people in town. Appointments are made only in Northfield. Is that true?
That's not true. That's an interesting question, really good question. And there's a rumor going around town that we're leaving or we're no longer seeing patients or our door is closed or something. I don't really get it, but that's certainly not true. We're open Monday through Friday, seeing patients here in town just like we have since 1985. So our doors are open. We're seeing patients locally.
And you do have a facility in Northfield.
We do,
too, right?
we do. But if you're from town here, there's no reason to go to Northfield. You can see us here in town.
Oh, well, that makes perfect sense. Why would you want to go somewhere if you don't have to go there?
You bet.
So how do you know if you had a meniscus tear in your knee without an MRI?
You know, it's that's another really good question, and it's I would say it's impossible to know for sure without an MRI. You can be suspicious that someone has a meniscus tear based on their history, based on their exam, and based on a normal X-ray. You don't see a meniscus tear on an X-ray, but you can't tell for sure unless you get an MRI scan. And you know, oftentimes degenerative meniscus tearing can go hand in hand with significant arthritis. So someone who's 80, who has a bad knee, their X-ray looks terrible, meaning they have bad arthritis, bone-on-bone arthritis. We don't usually get an MRI scan to look for a meniscus tear because we know they're going to have one. If we're suspicious they might have a fracture or something, then you might get an MRI, but it's real uncommon for us to order an MRI in that age group.
And will this heal on its own?
Meniscus tears don't typically heal on their own, but that doesn't mean that they cause symptoms. I think there's probably millions of people that have an asymptomatic meniscus tear. That tissue kind of dries out and cracks and wears out like all of our other soft tissues in our bodies, and doesn't always cause symptoms. Then, you know, you might kind of turn the corner and twist your knee a little bit, and you might tear it further, and now the tear gets into an area where there's a nerve that senses pain, and then you have symptoms and should come see us.
And I can't remember, was you or Dr. Stromer on this program talked about the last resort being a joint replacement?
Yeah, I agree with that. You know, we reserve joint replacement for end-stage arthritis where we've tried X, Y, and Z, 1, 2, and 3, and it just isn't helping any longer.
Because I have some arthritis, and it is, you know, it's painful.
Yeah, but most of the time you can tolerate the discomfort
Yep.
from arthritis. You know, it depends on severity, it depends on your perception of pain, but yeah, there's millions of people that have arthritis in our country, and the vast majority are treated non-operatively.
You know why that is? Is it our climate? What's the reason why we have?
Not sure. I mean, nobody knows the cause of osteoarthritis. You know, that hasn't been determined. Why some people get it and why some people in their 80s and their joint is perfect. You know, nobody knows for sure.
Well, I know some people. I've known some people that have been told, you know, move to Arizona or something.
Yeah, for whatever reason, the climate change around here brings out symptoms. You know, we see it oftentimes kind of a few weeks ago where it's kind of starting to warm up, it's a little warm, and then it gets cold again. That kind of fluctuation in temperature, we see it in the fall, we see it in the spring, where the phone is kind of ringing off the hook because people's arthritis is kind of flared up and giving them trouble. It's when the temperature is constant, either constantly cold or constantly warm, that people function the best for whatever
So what
reason.
I need to do is come into your facility, Dr. Muench, and ask you to write a letter for me saying that I have to go to a warm climate, and then see if I can write off some of that on my taxes because it's ordered by the doctor.
Oh boy, you better be careful. Obama would find out about that.
What do you think?
I think that's a bad idea.
Oh, okay.
You better be careful.
I'm just trying to think of a way to avoid winter, if you know what I mean. I'm sure you get some injuries, you know, shoveling snow.
We do, yeah. You can tear your rotator cuff or throw out your back shoveling snow.
People don't stretch typically before
No,
they shovel.
exactly. It's a really good point. Yeah, you probably should. And, you know, the snow and ice is killer around here. People slip and fall all the time and unfortunately break their wrist or their hip or their ankle. So really common.
Yeah, well, that's how I sprained my meniscus.
Yeah.
Was slipping on the ice.
Yeah.
Fell down, and I knew something immediately because, you know, there's that shot of pain. And
yeah. Feel like you're going to throw up.
Well, plus my knee went cockeyed in a different direction. So
Yes.
oh boy, I'm in trouble.
Yes, that's not a good sign.
Went into the station and
Yes.
eventually went through the whole therapy thing.
Yeah.
First thing they did was look at my shoes.
Mm-hmm.
Threw out all my shoes.
Uh-huh. Worn out and slippery on the bottom?
I guess. I don't know. I didn't see anything wrong with them. But I wouldn't, right?
Right. You may not think to look at that.
No. Again, Dr. Clinton Muench is with us from the Orthopedic and Fracture Clinic. I sure appreciate you coming in. Again, congratulations on your award.
Thank you very much, Gordy. Appreciate it.
Very deserving.
If you need us, give us a call, 507-334-1601.
Well, I have to be totally honest with you. I hope I don't need to see you.
That sounds good.
You know, for your services.
Stay
But
healthy. Keep stretching.
If I do have another problem, I'm certainly going to come to you guys.
We appreciate that. Thank you
I know
very
that.
much.
The Orthopedic and Fracture Clinic. What's your phone number over there?
507-334-1601.
And if I have a problem, I can just call. And
Just give us a call. We'll get you in.
again, that number is?
507-334-1601.
Thanks, Doc. Appreciate
Thanks,
it
Gordy.
very much. Dr. Clinton Muench, our guest today on AM Minnesota. Tomorrow, Faribault's Police Chief Andy Boland will be with us. That concludes today's edition of KDHL's AM Minnesota.